Doctors with disabilities exist in small but impactful numbers. How do they navigate their journey? What are the challenges?
What are the benefits to patients and to their peers? And what can we learn from their experiences?
My name is Lisa Meeks.
And I'm Peter Poulos.
And we are thrilled to bring you the Docs with Disabilities podcast.
Join us as we explore the stories of doctors, PAs, nurses, OTs, PTs, pharmacists, dentists, and other health professionals with disabilities.
We'll also be interviewing the researchers and policymakers that drive medicine forward towards real equity and inclusion.
Hello, and welcome back to the Docs with Disabilities podcast. In this episode, we are delighted to be joined by Dr. Katherine Vakil, a pharmacist and pharmacy services manager based in the Chicago area, and guest host Dr. Kruti Shah, who is a clinical operations pharmacist at Rush. Dr. Shah was recently featured on the podcast as a guest in episode 74. If you haven't yet listened to that interview, we highly recommend you check it out after finishing this one. Today, Dr. Shah is back, this time in the interviewer role, for a conversation with Dr. Vakil about navigating university and pharmacy school with a disability, figuring out what speaks to you in your career journey, and learning how to seek out the accommodations you need as a learner and as a patient. We begin with an introduction from Dr. Vakil.
I am a pharmacist. I'm actually a pharmacy services manager at Erie Family Health Center, which is a federally qualified health center in the Chicagoland area. So we primarily serve uninsured or underinsured patients, and my team is really focused on ensuring medication access for our patients. So making sure the medications are affordable, navigating the pharmacy system, all those things. And we have 13 clinics throughout the Chicagoland area, and we serve all of our, I want to say now it's about 80,000 plus patients that we have. I really, really love that work. And then I recently started to dive into disability advocacy, I think within the last year and a half, and it's been really an incredible journey for me. I've learned a lot, and I think especially in the healthcare space, there's a lot of room for growth. There's so much that we have done so far, but I also feel like there's a lot more room for growth as well.
That's amazing. Thank you for sharing that. Kevin Irvine, he connected me with you, and it was just amazing to see how much we had in common. And it felt like, although I did not know you, it felt like I could relate to everything that you were sharing with me, that we would like the listeners to know what is your connection to disability.
So I identify as hard of hearing. I was born with severe to profound hearing loss. And I started wearing hearing aids when I was 3 years old. I'm completely oral speaking, so I do not know ASL or do not communicate with ASL. I communicate primarily through speaking and hearing with my hearing aids. And yeah, it's funny that you mentioned, Kevin. I was so excited when he says, I know another hard of hearing pharmacist. I'm like, what? There are other pharmacists out there that are hard of hearing? That was truly like a special moment for me, because I think up until that point, I felt very almost alone or isolated. I didn't realize that there were other pharmacists and other healthcare providers out there with disabilities. So that was really a special moment.
Yeah, I feel you and I hear you, because I felt the same way. I remember coming home and, my husband's like, how was dinner? And I was like, oh my God, you have no idea how amazing it felt. You mentioned that you were 3 years old when you started wearing hearing aids. And so how was your journey as a child, teenager? How was your relationship with your classmates, your teachers, and actually also your hearing aids? Did you like them? Did you not?
I grew up in a suburb of Chicago, so I was very privileged to go to the good public schools, and I did have a lot of accommodations provided for me. When I first started in preschool, I was actually put in a special education preschool because of my disability, and they saw that I was doing fine academically. They put me in the quote normal public school. So then I went into a public school and I had an FM system where each teacher would wear a microphone and then the sound would go directly into my hearing aid. I think reflecting back now, I think it did help me, but I feel like there may have been better things that could have helped me along the way. So just for those that are not familiar with being hard of hearing, just because you amplify the sound or make a sound louder doesn't necessarily mean that I can comprehend or understand what's actually being said. So while that system really, again, helped amplify the sound, it didn't always mean that I understood every single word. But I think as a kid, though, I didn't really realize. I kind of just dealt with it and moved along. I think for me, I just worked extra hard to figure out what was being said. It was almost like a little puzzle in my head. What was that word before? What was that word after? Oh, this is what that person was trying to say. Overall, like when I reflect back on my childhood, there wasn't anything that really stood out to me as like a quote, like a bad experience. But I do think I realized that I did have to work extra hard. There was probably a lot of information that I missed that I didn't realize that I was missing. And I just kind of went along with it.
So that's amazing that you took the challenges as it came. And it seems like you said, let's see what I can do, what's in my power. That is to work hard and to work smart and to fill in the gaps and be present in the moment. That's just incredible because I know that it is not an easy thing to do. So thanks for sharing that. And then as you got older, how did you come upon choosing pharmacy school? And what was it that made you feel that this is what I want to do?
So, unfortunately for me, my mother passed away from breast cancer when she was 13 years old. Growing up, I think because pharmacy was more visible to me, we were going to the pharmacy almost every month, every week with every new regimen or supportive regimen that she needed. That was just the most visible healthcare experience for me. I had it in my head that I wanted to be a pharmacist ever since then. My mom was also a Latino woman, which also kind of ties in my passion for public health and population health. So I wanted to help patients, but also marginalized patients or underserved patients similar to hers.
How was the journey of navigating college and pharmacy school with accommodations? How did you navigate the big classroom halls and studying during pharmacy school?
That's a great question. Truly, I wonder how I did it myself. Looking back, I actually had no idea that I was able to ask for accommodation. So once again, I just went through the motions with college, undergrad, pharmacy school, and then getting my master's in public health. So I just quote dealt with it. Looking back now, knowing what I know now, I wish I had requested accommodations. I wish I had known who to go to for accommodations because I was in a large conference hall with 100+ students. The professor was like way down there. So I think what I just did naturally was I would always sit in the front seat to make sure that I can see the professor, whoever was talking. So once again, be able to read their lips. I relied on my classmates for notes. Like if I was like really not following something today, hey, hey friend, can you share your notes with me? What happened in that last half of the lecture? I really just relied on my friend, which I'm super grateful for. And especially in pharmacy school, we're all going through it together. It's very hard. It's very strenuous. So everyone's really willing to help each other out. So that was really nice. I think going from undergrad where everybody had different majors, it was not always as connected, but in pharmacy school where we all had the same end goal, it was a lot easier to share notes and make those connections there. But yes, I did it all without any accommodations, and looking back, I wish I had known about it, and then I would have requested some.
You were relying on lip reading. It just almost seems like it's impossible preparing for any lectures ahead of time, doing the post reading. And it goes to show that we could maybe at pharmacy schools and college do a better job of having accessibility services talked about during orientation, because otherwise we have no idea. Did you feel that there were assumptions made about you at all by other people, by professors?
It's probably more myself. I probably internalized it myself. I mean, being hard of hearing, I wear hearing aids and I have long hair. So most of the time I'm able to just have my hair down and nobody would even know that I am hard of hearing. And I probably did internalize it and I never really made it a point to talk about it. If I didn't hear something, I maybe asked somebody to repeat once, but if it became a little bit more difficult than that, I just let it go and figured it out on my own. So yes, and I don't think externally I felt it in the school environment, but internally I definitely felt it. I wanted to be, yes, again, proficient. I wanted to show that I can be a pharmacist. I can take care of patients. My disability doesn't stop me from doing that. I mean, now looking back retrospectively, I think that's probably why I feel like all the disabled folks that I've met so far are probably like some of the best people I met because they're the most creative, they're the most empathetic, and they know how to overcome challenges better than anyone else that I ever meet because we live in an environment that's not really accessible to the disabled community. So we're forced to every single day be creative, figure out a way to move forward, and while it's been a great thing for me because it's developed my work ethic, I don't want to portray the message that you have to suffer through anything. Everyone deserves it. Accommodations. You have the right to accommodation, but I think that's one of the beautiful things about the disabled community is just how they're able to just navigate anything that life throws at them because the world forces them to pretty much.
That's absolutely true. That is so true. And in this situation that you mentioned, like, just having that connection with other people who are navigating a similar journey just tells you that, hey, there's actually nothing to be shameful about to have an accommodation. But not only that, that there are XYZ accommodations that are available for you. When we have disabilities, a lot of times we think that the burden of navigation, the burden of accommodation, access, and speaking up, all of that falls on the person with a disability.
Yeah.
But in reality, ideally, what we want is to make our healthcare system, our school, more accessible so that the person does not have to feel that they're bearing all the burden of finding where the accessibility service is. It should be a two-way street. We're gradually getting there. More and more students, if we're able to reach out to them and say that, hey, request accommodations. But it takes the entire community, an entire system to make changes in order to achieve that.
In the next section, the conversation continues to discuss Dr. Vakil's career after finishing her pharmacy training and earning her MPH.
My very first job outside of after finishing my master's in public health was in the retail pharmacy setting. I was really excited. I got my first real job. But in the retail pharmacy setting, as many people listening probably know, it's about 90% on the phone. And as a hard of hearing person, it is extremely difficult for me to navigate and hear. And the stakes were extremely high because now I'm hearing prescriptions over the phone. If I make a mistake, that's a patient's life. And so it was a lot of pressure for me. And up until this point, I've navigated without knowing that I could ask for accommodation. So I started to question my ability of being a pharmacist. Like, can I actually do this? Did I make the right choice going into this profession? How am I going to help patients? How am I going to help the providers that I communicate with? There was a time where I really questioned, what am I going to do now? I just spent 9 years in school. How can I just let all of this go? So that's when I finally went to my audiologist and I asked him, I'm like, I cannot talk on the phone. I have no idea what to do. And that was probably my very first instance where he said, oh, I can set something up for you on the phone. Essentially, it's that same kind of system that I had going through school. It was like a little Palm Pilot that I got to wear, where the phone call went directly into my hearing aid. And I said, wow, that exists? He said, yes, there's a bunch of different options. And that was just so mind-blowing for me that option even exists. All I had to do was ask my audiologist. So imagine if I had known to ask, let's say at my orientation or whoever the person was that I should have asked at my place of employment. So I was able to set up that phone system wherever I went. It was still challenging, like I mentioned earlier. Just amplifying sound doesn't necessarily mean that I comprehend everything, but it definitely made things better. I think the next step for me was start to gain confidence. A lot of times I was working alone, so it became really difficult. But if I did have the help of a pharmacy technician or another staff pharmacist there, I would ask them to possibly take more of the phone calls, and I'll take the load of other tasks in the pharmacy to figure out how we can best navigate this. So in those situations, it was much, much better. It was really stressful. It was very traumatizing for me because I was so worried about making a mistake. I was so worried about harming my patients that I was serving. I don't think I was able to truly do the best that I could possibly do. And I think that's when it clicked for me. Having an accommodation really means that I'm able to work at my full potential. So that was like just a huge turning point for me. I had no idea that even existed, even though I'm no longer in the retail pharmacy setting and now I'm in a more administrative setting, which makes more sense for me, my personality, as well as not being on the phone 90% of the time. That was really an important point for me in my career.
Wow. Yeah, I can just see how stressful the situation could be. I feel that if there is an individual who is still at the cusp of not wanting to disclose their disability and not fully wanting to embrace their disability, that accommodation part could be challenging. There could be attitudinal barriers along with access barriers. So, at what point were you openly, confidently sharing the identity that yes, I have hearing loss, that I need the X, Y, and Z accommodation?
So I think that turning point story that I just shared, I think it forced me to. I don't know though that I was necessarily ready. Again, this was my very first pharmacist job. I wanted to show that I can be a real pharmacist. I don't have anything holding me back. It wasn't until I completed a fellowship with the organization Disability Lead, where I got to connect with other disabled leaders, and I got more embedded into the disabled community. I started to embrace my disability identity, I think. And that took several years in my pharmacy career. I was working as a pharmacist up to that point about six years. So still, if I talked about it, I would say, instead of a phone call, let's meet in person. I would be very subtle about it, but I wasn't very vocal about it like I am now. It took for me being embedded in the disabled community, finding my people, so to speak, before I really felt comfortable to shout it from the rooftop.
You mentioned that now you are at Erie Family Health Center. You're a pharmacy manager, but you started as an employee and then you moved up. So tell us about what you do there and how you navigate this space.
It was quite a journey. So I actually first started out in the population health field. So my title was population health coordinator. So I really wasn't doing anything related to pharmacy. I think I had reached a point in my career where I was really missing doing something with my public health degree. I wanted to see what could I do with that. So that's how I ended up at Erie. And so I started out again as a population health coordinator, and it was coordinating different outreach programs for people that were due for their diabetes follow-up. They were due for their breast cancer screening, colorectal cancer screening. So it was still clinical in nature, but not pharmacy focused. But then over time, as I was embedded within the clinic and connecting with the different providers and leaders there, and anytime a pharmacy situation came up or a medication question came up, I would provide my thoughts and insights. Maybe it could be done this way. It was great. That's why I never say that I regret working at the retail pharmacy setting, because all that knowledge came with me in my current work. I was able to explain why something was getting rejected, or how to navigate this problem or this medication shortage or whatever the case may be. I was able to share that. And over time, they were like, oh, let's go to Katherine for this pharmacy question, and let's go to Katherine for this pharmacy question. So then at that point, I became the pharmacy coordinator. So it was mostly just, again, like navigating simple things like refill requests or something getting rejected. But then, like I mentioned earlier, we're a clinic of 13 clinics. We have over 80,000 patients, and, medication problems and issues happen all the time. So it grew pretty quickly, pretty fast. There was a huge need for it. So I now have a team of 6 pharmacy technicians that basically navigate all of those issues all day, every day. And I know now in our current environment, we're dealing with a lot of medication shortages. A lot of people have lost their jobs or changing jobs. They can't afford their medication. So and over time, I was able to kind of merge my love for public health and pharmacy to be able to serve. And really, at the core of what I love is to be able to provide access to medication, because your clinical progress doesn't matter if you're not able to pay for your medication. Your clinical progress doesn't matter if you don't have a refrigerator to store your insulin. So being able to merge those two things was a really cool thing for me to do. I'm now the pharmacy services manager, and every single day still there's a new pharmacy question that comes up, and they come and ask me, and I'm really excited and eager to help. But that's one of the things I think that's beautiful in the pharmacy profession that I see all the time with all the people that I admire. It's just always showing your worth, continue to show up every day. Eventually, it will pay off. And then at the end, a lot of patients will benefit from it as well.
Oh my gosh, I am getting teary just hearing about this, because it is so moving how you've navigated that journey and never let yourself down, that you are now providing access to those patients who do not have the healthcare access. People are coming to you, you're resourceful, you are empathetic, and that is truly beautiful. And it makes me feel that it is because of your journey that you're able to completely give that comprehensive, empathetic love and care that the community deserves.
In addition to the many roles she has already described, Dr. Vakil also began a disability employee resources group for herself and her colleagues at Lake Erie Health Center. In the next part of this episode, Dr. Vakil explains how this group came to be and what it hopes to accomplish.
So tell us about the Disability Employee Resource Group that you started brand new from ground up.
So after I completed my disability lead fellowship, and that's again when I started to get really embedded in the disability community and connected with my people, I was like, wow, I really need this in my workplace. And I also feel like there has to be other disabled healthcare providers in my workplace. If I met another hard of hearing pharmacist like Kruti, there has to be around me. We're just not talking about it. It's probably taboo. At our organization, there was a really big push for DEI efforts. There was a new committee that was formed, which was fantastic. There was an also open call for employee resource groups, or ERGs. And that's when I was like, oh, okay, I'm going to apply for a disability ERG. let's see what happened. Luckily and excitingly, that was approved, and we were able to create a new disability ERG in our organization. It just started in November of 2022. And I went in without any ideas of what I wanted to do, but the core thing that I wanted was to create a safe space for all of our disabled employees to come, to be able to share their stories and learn from one another. I think that really has been pivotal for me. It's just learning from others and having a place to be able to share my story and also vent. Like today was a hard day. I didn't have XYZ accommodation and I had to go through it. That was also really important for me, and I wanted to be able to create that space for others as well. It's been growing really great. We've had a good group of people. It's less than 10 people, but it's been very consistent. We share a lot of stories. We also vent, and we've also been able to make small but very impactful changes in our organization, from like some simple things like meeting best practices, accessibility, things to think about to make your meetings more accessible. We have many other ideas, and right now we are celebrating Disability Pride Month as an organization, which historically has not come up before. And I want to side note, I think more organizations need to celebrate Disability Pride Month, but we got to start somewhere, right? So that was really exciting to be able to just share Disability Pride Month, that it's important for us in our organization. It's been going really, really great, and I'm very grateful for the opportunity.
Wow, that's amazing. That is so amazing. It's such a beautiful junction that we're at. I mean, when you think about disability, it's like, is it something to be proud about? And yes, the reason I am able to lead with love, lead with my identity of disability, lead with empathy, and be a better pharmacist is because of my very disability. And that is in itself, it's so beautiful and so powerful. So thanks for sharing that.
In the next section, the conversation shifts to touch on Dr. Vakil's experiences as a patient during the COVID-19 pandemic. Listen or read along as Dr. Vakil discusses some of the communication barriers that she faced during the pandemic and beyond.
And I know as a pharmacist and, dealing with a pandemic when mask was a huge barrier, I'm sure that was a very, very stressful journey. And I know you have a toddler and now you're pregnant with your second one. So congratulations. And, how was the journey of being a pharmacist during the pandemic, but also being a patient during labor and delivery during the pandemic? How did you navigate that?
Oh man, it was very hard. So first talking about being a pharmacist. So because my role is administrative, I was able to work from home most of the time, but it meant that all of our meetings shifted to virtual. Then again, I lost having the connection of being able to talk to somebody in person, being able to read their lips. Now all these virtual phone calls again made it extremely difficult for me to hear or comprehend what was being said. Even video calls was helpful to be able to see the person, but then again I would miss things that were happening. So captions became a huge need for me, and now probably the number one accommodation that I request when I'm in a meeting. And now as a patient, when I was pregnant, I had many appointments, and I had to go to different specialties. It wasn't always just in my one regular doctor. It's funny that as I reflect, how I was so vocal and advocating for my accommodations and needs in the workplace, but as a patient, I still didn't demand what I needed or requested the accommodations that I needed. So then everybody wearing masks completely eliminated my ability to again hear and communicate with others. Like people wearing masks, having another garb on top, plus the plexiglass in front of them. My hearing went from maybe being able to hear things 60% of the time to probably 20% of the time. And I know everybody was really stressed during that time as a healthcare provider, I empathize with that. It was an extremely stressful time, so people were very impatient. They did not want to keep repeating what they were saying over and over. So it was just a very highly stressful time for me as a patient. So my first pregnancy, which was in 2020, it was very stressful and it was truly not a good experience for me. And I again wish I had known to speak up and ask for the accommodations that I needed as a
Yeah.
patient. On the flip side, though, now I am pregnant with my second. While most of the mask mandates have been lifted, there's still many that are wearing masks. But now I know to ask for a clear mask. It's just a simple request, and most people are able to do that for me. I'm definitely much more vocal about letting them know I'm hard of hearing. I will need a clear mask if I'm not going to be going to my regular doctor who now knows me well. If I need to go to a specialist or a different office for, let's say, an ultrasound, I will let them know ahead of time in case they don't have a clear mask and need to order it. I become much more vocal about it. I realize that it vastly improves my patient experience. Especially as a pregnant woman, I'm already stressed about many things. I don't need that additional stress anyway, so it's been a
Yeah.
much better experience for me this time around. But had talked about earlier, though, it's the burden still falls on me,
Mm-hmm.
a disabled patient, to always ask for it, to always request it at every place that I go. So one thing that I dream of for the future is for it to just be something that is already asked for in the beginning. And creating accessibility for a disabled community is wonderful and very important, but it actually helps everyone.
Yeah, absolutely. Because if somebody sees the clear mask, I'm thinking of the situation in the doctor's office, and if the clear mask box is out there, or even on their website, if they're listing prior to booking an appointment, like all these options are there, people could actually pick and choose. They can say, "Oh, I see these. Can you please put them on?" Because that would be actually really helpful for me. Such an easy job for both individuals, for both parties.
In this final section, Dr. Vakil shares her advice for audience members with disabilities who are considering pharmacy school.
What is it, Catherine? And as we're coming to the end, but I want to ask you, what is one or maybe multiple advice, more than one advice that you could give to our incoming pharmacy students who are thinking of pharmacy school but are navigating disability journey?
I think first, just as a pharmacist or aspiring pharmacist, don't be afraid to go after what you're passionate about. I think sometimes we see what other people are doing, or this is the way to be a pharmacist. There is no one way to be a pharmacist. Like looking at my journey, I went from retail to not even working as a pharmacist to back to pharmacy somehow. So just continue to follow what speaks to you, what calls to you. I truly believe that it will get you to where you're meant to be. And then if you are someone that is disabled, or number one, you can always claim that identity. There's no shortage of being able to claim that identity. No disability is not enough or too big. You are able to go ahead and claim that. And I also want to remind everyone that asking for accommodation, that is your right. It's never a burden on anyone. If someone makes it feel like it is a burden, that's on them. That's not on you. It is your right, and you are able to ask for whatever you need to be able to do your best work. Because I truly believe we need more disabled healthcare providers out there. A lot of people will experience disability in their lifetime. So I truly believe we need more disabled healthcare providers and more disabled leaders, because it would make us help serve our patients better and make us understand them better. So I think reminding yourself that your disability is not a weakness, like Kruti had said earlier, it's actually a strength, and it'll be a huge strength for especially the patient population that we'll be serving.
That was beautifully encapsulated, beautifully said. Thank you. You're absolutely right. It is a diversity, it is a different mindset that we need that will help an institution, a profession grow. Thank you so much, Dr. Vakil, for taking the time to talk to us today and sharing your journey. It was a pleasure to have you.
On behalf of the entire Docs with Disabilities team, thank you so much to our guest, Dr. Katherine Vakil, for all of your openness, wisdom, and wonderful advice in this episode. Thank you also to our lovely guest host, Dr. Kruti Shah. To our audience, if you haven't yet listened to Dr. Shah's episode, which came out this August, we strongly recommend you check it out as well. We hope you enjoyed this episode, and we hope you subscribe to our podcast and join us next time. This podcast is a production of the Docs with Disabilities Initiative. It is supported in part by the University of Michigan Medical School Department of Family Medicine and Disability Initiative, the Stanford Medicine Alliance for Disability Inclusion and Equity, and the Ford Foundation. The opinions on this podcast do not necessarily reflect those of the hosts, their respective institutions, or the funders. This podcast is released under Creative Commons Attribution Non-Commercial Non-Derivative License. This episode was produced by Lisa Meeks and Sophia Schlossman, with help from our audio editor, Jacob Thiemann.